Adventist vegetarian diabetics. Prove all things, hold fast that which is good. Sunlight. Law of health, number 4. Sunlight is one of nature's most healing agents. Ellen White. Heavenly sunshine is more than an old gospel song. Sunshine is therapeutic, healing, and preventative. The great thing is that, if you walk outdoors, you can get exercise, fresh air, and sunshine all at the same time. Vitamin D. The sunshine vitamin appears to form under the skin when it is exposed to sunlight. Most of the nutrient is formed in reaction to sunlight, but small amounts are also found in foods such as eggs and oily fish. Scientists have discovered a link between vitamin D levels and our ability to deal with glucose. There are vitamin D receptors in almost all the cells in the body, suggesting vitamin D plays a role in most chemical processes, but some of the more interesting roles in vitamin D include beta cell function and regulation. The cornerstone of diabetes. One source reports, specific receptors in the pancreas may only switch on when sufficient vitamin D is available. The thinking is that vitamin D may support the function of the pancreas. Many studies provide evidence that sunshine may help prevent diabetes. One such study says, it has been shown that adequate vitamin D levels may help protect against the development of type 1 and type 2 diabetes, although the exact reasons for this are not entirely understood yet. Adequate vitamin D intake may help improve glycemic control in patients with diabetes. 10 or 15 minutes in the noontime summer sun leads to the production of 10,000 IU international units of vitamin D. Diabetics may need more sunshine than non-diabetics. During periods of low or no sunlight, diabetics may wish to take a vitamin D3 supplement. Some studies suggest that correcting vitamin D deficiency could reduce insulin resistance and improve insulin secretion. There is a wealth of evidence showing that vitamin D is necessary for insulin secretion and can reduce abnormal increases in insulin resistance. Improving vitamin D status before irreversible defects develop in islet cells, insulin resistance, and related defects also appears to be important. A new study has warned people who have low levels of vitamin D are more likely to be obese and more likely to have type 2 diabetes. This study adds to existing research that suggests low levels of vitamin D are linked to an increased risk of type 2 diabetes. You are at greater risk for vitamin D deficiency if you are over 50, obese, diabetic, or vegan. The latter is because most dietary sources of vitamin D come from animal-based foods. You can ask your doctor to order a vitamin D blood test. According to my healthcare provider, the normal range is 20 to 79 nanograms per milliliter. As we age. Unfortunately, people over age 50 have an increased risk of vitamin D deficiency, and the risk increases with age. As people age, they lose some of their ability to synthesize vitamin D from sunlight. Vitamin D is provided by skin synthesis by UVB irradiation from summer sunshine and to a small extent by absorption from food. However, these processes become less efficient with age. Many experts suggest that 1,000 to 2,000 IU, 25 to 50 micrograms, 1 millionth of a gram, of vitamin D daily is necessary for older people. Health Canada advises all adults over the age of 50 to take a vitamin D supplement of 400 IU each day. Serotonin. According to Dr. Roger Gallant of New Start, sunlight helps our brain produce serotonin, the feel-good hormone. It's what makes our brain happy and content. He recommends getting out in the early morning sunlight and let the light hit your closed eyelids without wearing sunglasses. It shifts your body from the melatonin at night to the serotonin of the daytime. He recommends getting about 30 minutes a day in the sunlight. He also recommends getting your vitamin D tested, particularly if you live farther north of the equator, to find out if you need a vitamin D supplement, especially during the winter months when there's not as much light. Circadian rhythm. An additional benefit of sunlight is its crucial role in your circadian rhythm. Dr. Arlene Taylor, brain function specialist, describes it. When sunlight enters the eye, it strikes the light-sensitive retina. Remember, the retina is part of the central nervous system, CNS, and is connected to the brain via the optic nerve. The retina contains different types of cells. The photoreceptor cells are sensitive to light. No doubt you've heard of rods and cones. These cells are specialized neurons in the human eye. Rods are more sensitive to light and help you see under low light conditions. They do not process color vision, however. Cones are capable of color vision and are responsible for high spatial acuity. They need more light to produce a correct signal, however, so may find it difficult to process color on a dark night outdoors. The photosensitive ganglion cells in the retina, discovered only in the past decade or so, communicate not only with the master circadian pacemaker or clock located in the brain's hypothalamus, known as the suprachiasmatic nuclei or SCN, but also impact many other brain areas that are known to be involved in the regulation of several functions including your health. Visit our website at AdventistVegetarianDiabetics.com. Follow our blog at AdventistVegetarianDiabetics.com/blog posts. Subscribe to our YouTube channel at youtube.com/AdventistVegetarianDiabetics. Copyright by Adventist Vegetarian Diabetics.